So how does tamoxifen work? To understand tamoxifen mechanism of action, first we need to understand how estrogen affects breast cells. Estrogen is a primary female hormone that plays several key roles, one of which is supporting cell growth and reproduction in various tissues, including breast tissue. It exerts its effect by binding to specific receptors on cells, known as estrogen receptors. In normal breast cells, estrogen binds to these receptors, activating them and causing a cascade of signals that promote cell growth and division. This process is healthy and natural under typical circumstances. Some breast cancers, known as estrogen receptor positive breast cancers, rely on estrogen to grow and spread. When estrogens bind to the receptors on these cancer cells, it sends powerful growth signals, essentially fueling the cancer cells and encouraging them to multiply. When tamoxifen is administered, it enters the bloodstream and reaches breast tissue. There, it competes with estrogen for the same estrogen receptors on breast cells, specifically on the cancer cells. Because tamoxifen has a high affinity for these receptors, it effectively outcompetes estrogen and binds to an estrogen receptor. This prevents estrogen from attaching to estrogen receptor, which blocks the signaling pathway usually activated by estrogen. Without this growth promoting signal, cancer cells are deprived of the fuel they need to grow and multiply. Consequently, this leads to a slowing or even halting of cancer cell proliferation, ultimately helping to control or shrink the tumor size.